ndinonzi Precious Msindo, ndiri mugari wemuEpworth uye ndichishandira muEpworth. Ndichishandira organization iyo inonzi Springs of Life Zimbabwe, inova iyo sex worker led organization. Kana ndichiti sex worker led organization kureva izvo kuti utungamiriri hwayo hwese ndewe ma-sex workers. So nhasi tiri kupemberera uye tiri kufara sema-sex workers eZimbabwe nekuda kwelaunch yelenacapavir rinova iro injection ratinenge tichibaiwa kairi pagore rekudzivirira kubatira utachiwana hweHIV and AIDS. Saka tine mufaro wakanyanya kuti hurumende yedu iri kutirangarira nekuti pataurwa kunzi first priority are going to be the key population. So isu, some sex workers, we are part of the key populations and we are very happy to be recognized. Nekutanga uye kutanga ku access this lenacapavir. So matambudziko mamwe atati nawo angari pill burden yekuti dzimwe nguwa ndinoti ndikarohwa hangu nemanginde ndokanganwa kumwa piritsi, but with lenacapavir ndakungobayiwa kairi pagore kureva kuti ndakufanira kungoisa alamu yangu yekuziva kuti nereminder kuti musi wa20 ndiri kufanira kunobayiwa, ndongorimemba ndoenda kunobayiwa. Ende remember kuti kuvhizita chipatara masikati ini manginde anondirova manheru ndakubasa. Inini upenyu hwangu handidi kushora mubereki wangu. Mubereki wangu was a sex worker, but akandireisa zvakanaka, ndikatoenda kuchikoro zvakanaka. Upenyu hwangu hwanga hwakanaka, handibodi kushora sex work kuti yakashata kozi yakandiendesa kuchikoro ikandichengeta kusvika pandiri nhasi. And inini sex work kuzoiita it's by choice, kwete kuti ndine dambudziko randakasangana naro. Dambudziko randingatosangana naro nderekuti ndabva kuchikoro kuti ndichiwana basa, but otherwise handina rimwe dambudziko. This is by choice.
Alright, so tauya kuzotsigira mutambo wokuparurwa kwechironga chokudzivirwa kweHIV tichishandisa mushonga unoita zvokubaya unonzi lenacapavir. Isusu tabva kuOFID inova organization iri maringe neHIV care and treatment. So mushonga uyu wakatinakira ende tiri kuuda zvachose nekuda kuti unopiwa kamwe chete mushure memwedzi inokwana kuita 6 mitanhatu. Saka tinotarisira kuti maringe nemapuwirwo awo vanhu vachaudawo zvekare nekudawo kuti hapasina mukana wekuti munhu arambe achiuyawo clinic since ari kungouya kamwe chete in 6 months. Uyezve unogona kuvandudza mararamiro evanhu vari kutsvaga kudzivirira utachiwana hweHIV nekudawo kuti vaane nguva yekuita zvimwe havacharambi vachiuya kuclinic.
Semwana wese ngada kuti chine drug batira utachiwana.
I think it's the best drug because inokurudzira uye inoderedza utachiwana hweHIV kuti upararire. I think it's the best and siyana nemapiritsi ekuti tino vanhu vanombomwa vachikangamwa. Saka mapiritsi ukabayiwa and then unenge wakungorekola date rako for the next review. Aiwa kufara tiri kufara because hatingambofare kuti utachiwana hweHIV hupararire. Saka apa tawanirwa solution iri easy isingakangamwiki. Saka tinongoti kune vese vari panjodzi yeHIV ngavanobayiwawo kunyangwe nevari mudzimba rakanaka futi kunyangwe nema-KP kunyangwe nevakomana vasati vawana nevasikana vasati vawana. It's a good drug iwewo kana uchizoti unoita zvebonde. Ini ndinonzi Ellen Makumbi. All right, thank you so much.
Soft music. Zvikuitika kama nasi. It is to launch Lena, the medicine, the preventive method. You know what you can do. It's so happening. Go.
morning. My name is Phil Nerving, and I'm the Deputy Chief Commissioner at the U.S. Embassy here in Harare. Ambassador Tremont sends her regards. She wanted to be here for this auspicious launch, but was called to the Ministry of Foreign Affairs and International Trade for an urgent meeting. So it is my honor this morning to join you in Epworth today to mark a truly historic milestone in Zimbabwe's journey to end HIV as a public health threat. The launch of lenacapavir, or LEN for short, an American innovation. Through the America First Global Health Strategy, American expertise has the potential to transform HIV prevention around the world, and right here in Zimbabwe. With injections just every 6 months, LEN will make prevention easier and prevent the spread of HIV. LEN is a groundbreaking medical innovation developed by U.S. company Gilead Sciences with support from the U.S. government. Thanks to American scientists who developed this breakthrough, we are providing people, especially young women, pregnant and breastfeeding mothers, and populations at risk, with a powerful new tool that is convenient, effective, and discreet. LEN represents the cutting edge of HIV prevention science. Already in use in the United States, Zambia, and Eswatini, LEN offers Zimbabwe an historic opportunity to sustain its remarkable progress in controlling the HIV epidemic by reducing new HIV infections. And that progress has been extraordinary. I congratulate the Ministry of Health and Child Care for leading these programs and achieving HIV epidemic control. To date, American people have provided $1.9 billion in U.S. taxpayer funds to combat HIV and AIDS in Zimbabwe. This support has been instrumental in helping Zimbabwe surpass the UNA's 95-95-95 targets, a world-class achievement demonstrating what we can accomplish when we work together. By collaborating with Gilead scientists to offer Zimbabwe access to LEN, the United States plans to support more than 271,000 Zimbabweans, directly preventing more than 9,000 new HIV infections in the next 3 years alone. Now, these are not just numbers. These are Zimbabwean children, men and women, safe, who will continue to pursue their dreams and contribute to Zimbabwe's national development. Gilead Services has also already signed agreements with generic manufacturers to make lenacapavir more affordable and accessible for people who need it around the world. More affordable for governments like Zimbabwe to buy supply for all who want or need it. That will be rolling out in the next few months. Since 2003, the United States President's Emergency Plan for AIDS Relief, or PEPFAR as we all know it, has saved over 25 million lives around the world. It remains the largest commitment by any nation to address a single disease. Through our global health strategy, the United States is helping countries to achieve self-reliance so that they can sustain the decades of gains made by the United States and countries like Zimbabwe in the fight together against HIV and AIDS. Saving lives, building resilient systems, driving American innovation and expertise, and fostering recipient country-led leadership to respond effectively to infectious diseases. Today, as we launch LEN as one of our most powerful tools to stop new infections, we have a key solution on our hands to end HIV. I congratulate the government of Zimbabwe on this achievement, and I wish you every success as you roll out LEN across all 10 provinces. I am confident that as the government of Zimbabwe takes even more leadership, an AIDS-free generation is within our reach. Thank you very much.
Let me recognize Mrs. Nyamjara, Wakamirira Senator Tawengwa, vanove Minister of State for Provincial Affairs and Devolution for Harare Metropolitan Province, Matiri. Ndoda kurecognize vauya vakamirira Permanent Secretary Dr. Nyamayaro abva kundisimudza apa. Rangarira zvakare Chairperson of the Senate Thematic Committee on HIV, Honorable Tongo Gara. Handina kuvaona but ndofunga pane vamwe vauya vakavamirira. Parliamentary Portfolio Committee on Health and Acting Chair variwo Honorable Molokela. Ndoda kuita respect ku Health Service Commission members dziri pano ne board members the National AIDS Council pamwe chete netimu yavo yakatungamirirwawo zvakare na Dr. Madzima. Let me also recognize members, senior members from our ministry, our development partners. Ndorangarira zvakare Mr. Philip vauya vakamirira ambassador weUnited States muno muZimbabwe wabva mukutaura. Ma-development partners ose, ma-NGOs and implementing partners, vatungamiri vemuma-community medu, people living with HIV and AIDS, members of the media, ladies and gentlemen, mangwanani. I hope achiri mangwanani, handiti? 12 patsadza kwanaka. Makadii zvenyu. Ndinofara kuve neminhasi pazuva rino tiri pano paEpworth. Tichiuya kuti tizoshambadza jekiseni rekudzivirira utachiona hweHIV rinonzi lenacapavir. So today marks an important milestone in Zimbabwe's national response to HIV. Lenacapavir is a long-acting injectable option for HIV prevention and to show our commitment to protecting life and ending AIDS as a public health threat. Ndofunga manyatsopabata ipapa. Ndere prevention kwete kurapa. Nokuti vamwe vanobva vafunga kuti ndobva ndarapwa nejekiseni. And ndere prevention yeHIV infection. Kwete kwete dzimwe siki. Handimozadza munoti siki. Ma-STIs hadzivirirwe nejekiseni ratikutaura. Over the past 2 decades, Zimbabwe has made strong progress in reducing illness and death related to HIV. Many families here know this progress firsthand. Takabva kure, asi rwendo ruchiripo. The journey is not yet finished. Ndinonzwa zvichinzi kune ma-adolescents akawanda akubata chirwere kunzvimbo ineyi. Ivavo vakazvarwa taane mapirisi, saka havanyatsoziva kwatakabva. Imi vechikuru rairirai vana kuti kwatakabva kwanga kwakaipa, hatidi kudzokera ikoko. New HIV infections continue to occur, especially among adolescent girls and young women and other populations at increased risk. This tells us something important. Prevention must fit into real life. If a health solution is too complicated, too demanding, or too visible, people simply won't use it. That is why innovation in prevention matters. Lenacapavir represents a new way of doing things. It responds to a simple reality. Not everyone finds it easy to take a pill every day. Life gets busy. Sometimes people forget. Anditi tinokanganwa tozi. tokanganwa tose here vanonwa mapirisi vanoziva kuti unogona kuakanganwa. And sometimes stigma makes it even harder to be seen taking pills. I am pleased to announce that Zimbabwe has received its first supply of lenacapavir and has already begun implementation, with the first clients receiving the injection earlier this month. This shows that our health system is not only responding to today's challenges, but preparing for tomorrow. The rollout is being done in phases. This is intentional. We want to do it properly, safely, and fairly. We don't want to rush and leave others behind. This phased approach allows us to learn, improve, and then expand access across the country. Lenacapavir is given only twice a year. That means fewer clinic visits and more privacy. As some people have already joked, you don't need a daily phone alarm to remember it. Once every 6 months. Importantly, lenacapavir does not replace other HIV prevention options. It adds to them, that is, it complements what is already existence. Abstinence, faithfulness to one partner, consistent use of condoms, oral pre-exposure prophylaxis, mapiritai, other injectables, ziripo, all remain important. Abstinence, faithful to one partner. Tirikuzviita here? Kunyarara zvinoreva kuti hatisi kuzviita. Tirikuzviita here? Ngatiitei vakomana nemadzimai kuti zvinhu zvitiitire zvakanaka. Hapana mushonga umwe chete unokodzera kana kuwirirana nemunhu wese. Choice is central to our policy. The introduction of lenacapavir is fully aligned with the Zimbabwe National HIV and AIDS Strategic Plan and with the global guidance, including recommendations from the World Health Organization. It has also been approved by the Medicines Control Authority of Zimbabwe, following the required regulatory processes. Ladies and gentlemen, we particularly acknowledge the United States government as the main funding partner for the introduction of lenacapavir in Zimbabwe. This support reinforces our collective commitment to accelerating HIV prevention gains and reaching populations most at risk with effective modern options. As we celebrate this milestone, we remain clear about the challenges that persist. Stigma, misinformation, low risk perception, and access barriers still affect our communities. Dzimwe nguva vanhu vanotya kuenda kunobvunza kana kuenda kumakliniki kuzvipatara chaiko. This is why we encourage everyone to rely on trained health professionals for accurate information. Please, musateerere makuhwa. Do not rely on rumors. Vasingazive ngavadzidziswe vorega kuita nharo. Come to the clinic, ask questions. Health services are there to help, not to judge. My ministry has prioritized strong policy foundations to support this rollout, from guidelines and health worker preparedness to supply systems and community engagement. Our goal is simple: to ensure that new innovations strengthen our health systems, and serve the people who need them most. We continue to work closely with partners, including Global Fund, the UN Family, and others, to mobilize resources that will allow us to expand access and sustain these gains. Let me sincerely thank the National AIDS Council, our development partners, civil society, health workers, and community leaders. Basa ra muri kuita riri kuonekwa. The work you are doing is visible and appreciated. To the people of Epworth and Zimbabwe at large, this is your program. This is your health. Lenacapavir is an additional option to help protect yourselves, your families, and your future. Utano upfumi. Health is wealth. Shandisai jekiseni iri. Zvichengetedzei nedzimwe nzira dzose dzinokurudzirwa neveutano. Together, through partnerships and shared responsibility, we can reduce new HIV infections and build healthier communities. The Second Republic, through the able leadership of our President Dr. E.D. Mnangagwa, emphasized health for all by 2030. Basa riri kurohwa. It is now
private and a highly effective protection option. This is what American expertise and innovation and global health looks like. Saving lives, removing barriers to care, and expanding partnerships for U.S. companies. The United States has plans to support access to LEN for about 271,000 Zimbabweans over the next 3 years. This could prevent 9,000 new HIV infections, which is critical to controlling the HIV epidemic in Zimbabwe. Building on decades of progress fighting HIV and AIDS in Zimbabwe, we are connecting U.S. medical expertise and innovation with the leadership and commitment of the team here at Epworth Overspill Clinic and elsewhere. The American people have provided over $1.9 billion to fight HIV/AIDS over the last 20 years in Zimbabwe, leading to achieving and sustaining the UNAIDS 95-95-95 goals. A world-class achievement that shows what happens when we cooperate and what we can do together. The United States has evolved from just providing aid to working closely with recipient countries and communities such as yourselves to achieve self-reliance. Thank you to the healthcare workers here at Epworth Overspill Clinic and across Zimbabwe for their dedication. And thank you to the government of Zimbabwe for your leadership in adopting this innovation quickly. Your commitment gives hope to thousands of people in Zimbabwe and elsewhere. Thank you very much.
Thank you.